Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. I'd like to talk about polyps today because this is something that is hidden inside uterus, and many times they are the reason patients do not fall pregnant or they do not carry a pregnancy to term, that is they undergo miscarriages. So what are polyps? How are they detected? How do they cause infertility is the topic for today. Well, polyps are endometrial tissue growing into a mass. They invaginate into the uterus, into the endometrium. It's the same tissue, they grow in size and they occupy various positions. So these, under the influence of estrogen, also keep growing, and such a patient may have abnormal bleeding or recurrent bleeding or bleeding between periods. These patients, because the same tissue responds also to estrogen and progesterone, the bleeding patterns also are different for these patients. So the effect of polyps is basically based on three factors: position, size and number. Position is very important because suppose the polyp is located at the entrance of the tube and it is blocking the tube, then the sperms, they may not be able to fertilize the egg, embryo may not form, the embryo may not travel down into the uterus to implant itself and may not cause a pregnancy. So position is very important. If it is present where an embryo is required to implant, then also pregnancy may not occur or miscarriages may also happen. That's position. Next is the size. If the size is very big, it is occupying reasonably large position inside the endometrium, inside the uterus, then also it is very dangerous. It's detrimental for the patient, especially when they're trying for pregnancy. Next is number. If they are small but they are located in various positions, various areas, and are not able to give space to the embryo to implant, this may lead to recurrent implantation failure, that is the patient does not get pregnant, or recurrent miscarriages as well. So these three factors play a very important role. How are polyps detected? Polyps can be detected by ultrasonography or scans if they are large enough. So it's very important to see the size. If it is large, then they are detected. Next is a saline sonogram. When a sterile saline water is passed into your uterus, it expands and polyps can be caught on ultrasonography. This is also a very good method to see where polyps may be present. Next is hysterosalpingogram, where a special dye is passed into the uterus and polyps can also be detected by this procedure through an X-ray. The last and the most gold standard procedure for polyp detection and evaluation and cure is hysteroscopy. It is where a camera is passed into the uterus, the polyps are located. They can also be diagnosed and operated on the same sitting where they are cauterized or cut from wherever they are. Polyps do not come back at the same location, but does not mean that they may not come back again. So hysteroscopy plays a very important role in the treatment of polyps. If you want to understand more about polyps, you have been diagnosed with polyps and you want to see what your treatment options are, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.